This is a long case, but here we are doing a short bedside discussion. This is a 11-year-old girl going to school. She was diagnosed to have a swelling on the back for which surgery was done, and after that she used to have repeated episodes of fever. She is intelligent and she used to walk to school with some difficulty. The initial surgery was done in the lower back, and after that, some other surgery also was done in the head region. From the history, it was obvious there was some meningomyelocele or meningocele or whatever for which the surgery was done, and following that, most likely another complication, hydrocephalus set in, and our guess was right. Looking at the side of the neck, there is, you can see the VP shunt. So the first possibility we considered in this girl with fever, headache and vomiting, two possibilities. Either it's a meningitis or a possibility of a block in the shunt. And other possibility was, of course, urinary tract infection. She used to get the urinary tract infection earlier also, for which she is on some oral medication. With that possibility, we considered, we looked for the signs of meningeal irritation. It was not there. She was fully conscious oriented. She was having headache and vomiting, dehydrated, and we corrected her dehydration electrolyte imbalance. Sensorium was well maintained. Till the possibility of meningitis was considered, the next closest DD was the blocked the VP shunt. But the shunt was working, and we did a CT also. That also didn't show any block in the drainage. This is the scar on the back. She was able to walk. She was having good power in the flexion extension at the hip and extension at the knee joint, flexion of the knee joint, but it is having the deformities, these deformities in the both feet. This was the scar clearly seen. Is the first and second possibility of a block of the shunt and the meningitis was less likely. We investigated further in the line of urinary tract infection, and she was confirmed to have a urinary tract infection. Her renal functions were within normal limits. Her blood pressure was normal, and after taking culture and sensitivity, she was put on antibiotics and she responded very well. We did the evaluation and of the localization of the lesion when she was better. So all right. This was the appearance of the foot. It was small in size on both sides, and there was a lesion, non-healing lesion in the sole, which they were managing at home with frequent dressing. In spite of these things, she was going to school. She was not having any pain here. We did the CNS examination. Her higher function, speech was normal, cranial nerves were all within normal limits. Fundus was normal, vision was normal. And the power, sensation, reflexes, all were normal in the upper limb, head and neck. She was able to sit, stand and walk. So the power of the trunk was normal, the hip and up to the knee was normal. Now comes the lower limb below the knee. The size was of the legs below the knee, both sides was thin, and both side feet was small in size, and the appearance was like this. So it is obvious that she had a myelocele with a parenchymal involvement, and there was hydrocephalus, which is corrected now. So where exactly is the lesion myelocele? So for that we need to know a little bit about the nervous spinal cord. This is the spinal cord. The power is decided basically by the lumbar plexus from L1, 2, 3, 4, 5, S1. Up to that is needed for the power of the proximal hip, then the knee extension, foot, intrinsic muscles. So the intrinsic muscles basically L4, 5 and L2, 3, 4 for the knee and sacral segment for the flexors. This also we need to have an idea when you evaluate the spinal cord lesion. So this is the sensory. This is the L1 here, L2, L3, L4, L4, L5, S1 from the front. In the back, see the sole of the foot, L4, L5, then this is S1, this one, 2, 3 around the perineal area. With this idea, we will see the clinical examination, small videos. The localization of spinal cord is based on the power, reflexes, sensation and whether the bowel bladder is involved or not. In this case, by history, there is involvement of the bladder. Bowel also is involved, but not much disabled. The urinary problem, dribbling is there. She is going to school, but she is wearing the pampers throughout. What we need to know is whether it is an LMN bladder or a UMN bladder. When the S234 is involved, that means LMN bladder. It will be continuously dribbling incontinent. If the lesion is above and S234 is intact, you will get a UMN bladder. In this case, most of these situations, the lesion will be the level of the lesion below. So to what extent is the power remaining and to what extent is the paralysis of weakness is gives an idea of to what the lumbar or sacral extension, how much is it. The position of the foot is in extension and inversion. That means there is an imbalance of the power. The flexors and everters are weak. That's why. So, she is having a lower spinal cord lesion. So, we need to check the power, reflexes and the sensation. So, she is showing the sensations from above down. കാണിക്ക് കുട്ടി കാണിക്ക്. എവിടെയുള്ളത്? അവിടെ അറിയണ്ട്. അറിയുന്നിടത്തേക്ക് അറിയില്ല എന്നെല്ലാം പറയണേ. പറയൂ. അവിടെ അറിയണ്ട്. ഓക്കെ. ഇടം വരെ അറിയുന്നില്ല മോൾക്ക്? അറിയുന്നില്ല. ഇപ്പം ഇവിടെ ഒന്നും അറിയുന്നില്ല അല്ലേ? കാലിൻ്റെ ഉള്ളംകാലം അറിയോ? ഇല്ല അല്ലേ? ഉള്ളംകാലിൻ്റെ അകത്താണ് കുറച്ച് ഈ പൊട്ടിയിരിക്കണം അല്ലേ? മനസ്സിലായി? ഓക്കെ. അവിടെ ഒന്നും അറിയില്ല അല്ലേ? ഓക്കെ. ഈ ഭാഗത്തും പൊട്ടലുണ്ട്. ഓക്കെ. ഓക്കെ. So from that it is obvious the imbalance of the power. The extensors and inverters are having good power. The flexors and everters are weak. That's why the foot is in the extended and inverted position. So there is a involvement of the sensory system, the roots, the S1 in the sole of the foot is not felt and the lower part also, that is L4, L5, S1, S2 back also should have been tested and that part also is absent. Now we'll check the power and the reflexes. The power of the knee flexors and extensors are normal. We expect a little bit weakness in the flexors of the knee, but not much during testing. The extensors are having good power. So the reflexes of the knee and the ankle are important because we expect the lumbar L1, 2, 3, 4, 5 to be 2, 3, 4 to be normal. L5, S1 we are doubting. So the reflex corresponding are in the angle jerk. So these two reflexes are important.
So knee is kept little flexed at the level of this. You can pass the hands beneath this thing and you try to see the little on the lower side. But this side it is present. Angle jerk intensity. Angle jerk intensity. See this part. Extensors are having good power. This side. So that means L5, L4, 5 is having normal power, and it is sacral segments. S1 sensation is lost, angle jerk is lost. So L4 up to L5, and below that this sensations is lost, and the power also is lost. Motor and sensory loss below S1 up to L5 on. So she is having incontinence of the bladder and the stools also. Back in the top.
We didn't investigate in the line of the reason for the urinary tract infection. Of course, that is another part of the multi-system evaluation. So this is just to localize the lesion in the spinal cord in the case of spina bifida when there is an involvement of the parenchyma. The importance is the segments from the motor examination, sensory examination, and the bladder. So that will give an idea. In this case, there is an element bladder, S2, 3, 4 is gone, and the power part, there is an intact, good power up to the L4, L5. The sacral and maybe a little bit of L5, intrinsic muscles of the feet is involved, and there can be a little bit power problem of the plexus of the knee, but she is able to walk. The proximal hip muscles are comparatively having good power. That's why lucky that she can move around, even though she is having much of the disability of this sensory loss in the feet and this much of bladder dysfunction. The happy thing is that she is intelligent, she is going to school, every other life is going smooth. So nothing much can be done to clear all these things. We are putting her on the prevention for the urinary tract infection. So far renal functions are maintained, there is no hypertension. So thank you.